Okay, so Riaz, tell me, who is Riaz Yar?
I'm just a normal average guy working in Manchester. And, but I'm a geek, and the thing with being a geek is that you want to measure everything. You want to know all the little things that are going on, and if you don't know, it really starts to bug you.
And you never got tired until you found something near, because you never found what you want actually.
Oh no,
As being
exactly.
a tech geek is all about that, you know. We are always finding something, and we are always seeking for, we don't know yet already what it is, but we
Yeah,
are
I think
always seeking.
we're wanting. I think we want sort of physiological perfection. I want to look at the teeth, and they look like teeth. You know, when we do the restorations, the thing with me is, you know, when you did your night, you did all the previous work. You know, it was always down to the credit of the technician. As long as we gave the space, they could do some beautiful work. But the shapes were always dictated by the articulator, and that
Exactly.
always used to irritate me. You know, it's like you do all your prep, you give the space, but the teeth looked okay, but they never really looked like a tooth.
Yeah. So you kept looking and seeking for
Yeah,
for the right shape of the cusp. Let's.
absolutely. And I knew that it wasn't, you know, the ceramist's fault because they were using an articulator. So I knew that, you know, it was the best they could do. And you would have to give more space for, you know, you have to drill more. So you were being less conservative to
Yeah.
get a better aesthetic result. And so you were then worried about this balance of, you know, function and aesthetics.
and
So
and and
I always felt
material resistance also, you know.
exactly, exactly. So we always gave like aesthetic results on the labial surface, on the buccal surface, but on the occlusal surface,
It
it
was a
looked,
mess.
yeah, it was like, you know, and I'm sure, you know, and you being sort of this, on the other side, you would, you know,
Exactly.
you were trying to deliver the best result, but you were restricted by the space and, you know, the
The
dynamic
function,
movement.
the
Yeah,
function,
the function of the articulator, you
the
know, the
function.
dynamic movement. Yes.
Exactly.
Uh, and now, you know, it's like, you know, I'm sad. I take pictures of the restorations from different angles because you can see the cuspal shape, and it just looks amazing. So now, you know, I mean, I'm 20 years qualified. So
Yeah.
I qualified 20 years ago. And, you know, I'm still as excited about sort of restoring a case as I was, you know, 15
Wow.
20 years ago. And, you know, part of that reinvigoration has been sort of MODJAW. That actually was the trigger because I always had an interest in inclusion anyway. And I was always searching, and you know, I sort of spoke to Marcel Legal, and I'd gone to France and Strasbourg, and sort of spent time with him. And, you know, it was always sort of like chasing around the world, seeing, you know, what people are doing. But
Just to feed that knowledge, angry sense that we all have, right? Like, isn't
uh,
it?
absolutely. And this was sort of, you know, it's like a jigsaw puzzle. You're trying to put the pieces in to make the complete picture. And until you have all the jigsaw pieces, the picture
Exactly.
is never complete, and you're always searching for that extra jigsaw piece. You know, something doesn't make sense here.
And how did MODJAW came into your life?
Well, I'd heard about MODJAW about probably about 3 years ago. So a year before they came to the UK. So I'd been sort of, I think actually, I think on Facebook I'd sort of messaged, and I had an inquiry, and I was like, you know, when are you coming to the UK? Because I mean, if they weren't coming to the UK, I would have gone over to France. So there was always that point where I thought, if it's not coming here, but they were saying they were coming. And so they booked a day in London, and I got the dates and everything. So I was like, day booked, I'm going over. And you know, I sat down, and I'd already sort of in my head done a bit of work on it. But you know, you see the videos, it's never the sort of the real thing until you see the demo and stuff like that. So, but literally, you know, it was like 30 seconds. Boom, that's it. That's it. That's what I've been looking for. That's my jigsaw piece. So I already knew straight away at that stage, this is one of the jigsaw pieces. It was like essential to me. I had to have it. So
and 30 seconds decision.
it was literally, you saw the jump. I was like, that's it, done. That's what I've been looking for. That's what I need. Forget,
Where do I sign? Where do I sign?
Yeah, and that literally that's what happened. Like at the end, because they were, they'd finished the day, and literally at the end of the day, I went to Antoine. I said, okay, I want this. So what are we gonna do? So he actually gave me the one they brought.
The demo unit.
Demo model. So I actually got that one because I just wanted it now. I was like, I want this. That's it.
And what is the 4D concept for you? On your regular and daily basis, how do you consider the 4D dentistry? This so-called, this is some huge word. In my opinion, it's a huge word. When we say 4D dentistry, not only the new dimension on space, it creates some good puzzle.
Yeah.
And what is it for you?
But I think the thing with me and occlusion and the patient, we always collect data from the patient, and it's always subjective data. How are you today? How are you? How you're chewing your food? How do you chew your food? Everything was like, ask the patient, they give you an answer. You never measured
exactly
anything. Even when we did the restorations, we'd do a case and we'd fit the case. Patient would come in for a review. How are you doing? Yeah, love it, happy. But you never measured the jaw. You never measured to see whether you made a difference. Yeah. And so for me, this was like key, because like what I do with the MODJAW, for me, I take the MODJAW. I was doing 3 MODJAWs per patient. So provisional, and then definitive after the definitive, to see whether we actually made a difference.
Where exactly? And where is the?
Yeah, exactly. Have we? And even like one case, I made a negative impact, and you could go and look at why you did that. There was one case, we created a non-working side contact, and his jaw motion reduced, and it became more vertical. And that made me look, why has he changed? He was good movement at the start, and now he's restricted his movement. And you found the problem, on the MODJAW, and so you corrected it. And it was like, this is, that was like, when you deliver the results and you see the results, and because before, the patient would always tell you anyway, if it looked nice, they're happy.
Yeah, pretty much.
Pretty much, it's very rare that a patient, if they're not happy with the aesthetics, that's when they complain. But it's rare that they'll come in and complain that they're not chewing their food, or, and even if they catch their cheek, you normally say to them, look, it'll be fine, you'll get better.
Exactly.
But this is now, we measure.
That's why we call it the game changer. It's on my personal opinion, and as a dental technician, the way I see it and the way it did change my workflows at my lab, it's a complete game changer, Riaz. When we received, for this complete mouth rehabs, we would have some kind of Facebook. Not every time, but sometime there was some enthusiast that would be courage enough to send the Facebook into the lab. and then 2 or 3 registrations, and the same cherry on top, like, oh, the patient is eccentric. so you don't need to do nothing. It's already, the registration I sent you is eccentric. And so this was pretty much our daily work at the lab, having this kind of registrations, this kind of analog procedures and protocols. And when I got the first XML coming from a MODJAW, I said, no way. So this is, after 12 years of experience and 8 years mainly in digital, I saw, you know, two models moving in natural movements. And it was like, whoa, what the
Yeah.
hell is here? And
Exactly, and you've got to really, to analyze. You learn so much. The first time I did it, I must have spent 2 or 3 hours, because I was looking at phonetics and looking at the movement of the teeth in phonetics. You can't do this stuff, before. You could never do a phonetic assessment
no,
before.
only by seeing, you know, you ask the patient, okay, now say spell Mississippi. And you said,
Yeah.
okay, it's pretty
Okay.
good.
Yeah. Exactly.
Go home.
And I actually did the test for that. I did 66 Mississippi and stop, because there was some literature about phonetics and which word to use and stuff. And I did that with the MODJAW. So I said to the patient, say stop. I looked at it and I said, say Mississippi, and I said, say 66. And then I looked at the movements for all the three, and you can never do this.
No. I was pretty much involved in digital dentistry already. You know, I started with Sirona and with InLab. I went in a bunch of trainers about InLab with, you know, like you said before, flying all around the world seeking for something. And then I stuck with MODJAW. You know, at the first time I saw it, I said, no, how this is done, how can you go from this to that like this, and pretty much this is the story, and that's the reason why I'm here talking with you about, you know, digital stuff and digital technology, and mainly about MODJAW. You know, this
Yeah, yeah.
is the
For me,
passion,
it's
the passion
passion.
that we can drive into a subject like this. It's enthusiasts, you know,
It
it's
reignited, yeah. It's certainly for me, it's sort of, that was it. It reignited that passion again in sort of, and it was the next step. We'd sort of used an articulator for 18 years of my life, because I sort of, the MODJAW, I've been a MODJAW user now probably for just under 2 years. I think it was like July 2019 was when we got the MODJAW, and we were the first. So I was the first in the UK, and then, as you can imagine, people started to hear, and I think at the moment now there's 5 in the UK,
some
which,
buzz.
and it will grow, because and it's not just, we talked about full mouth rehabs, but I've used it for bridges, you know,
Yeah,
cases, where you're doing sort of a couple of units, and you really just want to get that motion right, and you want to get the shape right, you really want to get the best restorations right. So I think for me, I mean, now, in the beginning, for the MODJAW, it took me, maybe half an hour. Now I can, I can
15
do the
20 minutes.
yeah, 15, 20 minutes, I'm done. And you can sort of, I've trained the girls to sort of do the scanning and stuff like that, but the MODJAW is my baby. No one touches the MODJAW but me.
So you don't allow anyone to touch your MODJAW.
I just trained. I had one of the other professors who works in our practice. We just did a case together, so I took out time at my clinic, and I sort of sit with him so he could do the MODJAW as well. And he was like mesmerized by it. But yes, for me, I know you can train the staff to do it, but I think this part is me quite important, that I start seeing things early on in my my case management. So I tend to book out 90 minutes for a full, what I call a detailed assessment. So from a business perspective, for me, it works really well. I book out 90 minutes. It's a charge about £900. So it financially is viable, and I get all my data, the photographs, the radiographs are done, any CBCT data. I also use EMG data. So I use TDAN, and I also get T-scan data as well. So I'm sort
A
of,
full digital planning is
yeah,
what you get in
yeah,
those kind of consultations.
absolutely. Face scan, everything is done. So literally in that 90-minute appointment, the MODJAW's done. So I have motion data, muscle data, and tooth data. So I can really sort of comprehensively look at the patient and say, okay, now I know what I need to do for you. And then that data is exported out to,
let's say, some emotional parts on everything that's happening during that kind of consultation. So when we say that we are digitalizing our patients, and I'm using here a total clinic expression, but this is exactly what I'm receiving at the lab, and I'm having a lot of fun, you know, and you know what I gain as a dental technician, and I was about to ask you that, you know, in the number of patients, and also because you are having all this digital planning priorly done. Do you feel that the number of acceptance is increasing, or are you getting, you know, more cases every month because of all this technology that you have now at your clinic?
Yeah, definitely. I mean, patients love it. You know what? You know, it always makes me laugh because, you know, when you start the MODJAW and they start doing their jaw motion, they start looking at the screen, and then the sensor goes off. And you're like, no, stop, look straight ahead. You're not allowed to look at the screen. They can't help it. They're like, you know, they're doing mouth opening and they're watching their jaw. So then they start to do this because they're watching their jaw do this.
No, the emotional part on that is priceless, and I truly saw exactly the same thing. Like, if we that, you know, touch and doing this every day still gets our, you know, mouth completely like falling in the ground, uh,
They love it.
just try. I'm trying to understand exactly the emotional part on a patient that never seen, you know, a digital model in his life. So, and if you have those huge case with CBCT, with wax up, with everything, you know, all the data that we are able and allowed to import into MODJAW, I would love to see, you know, a patient's face with all the things moving, you know,
Oh,
just
they love
to
it.
take a picture on that and say, wow, this is
Video.
this is the wow effect. This is the wow
They
effect.
love it. They do.
Yeah.
And, you know, and this is also an opportunity because, you know, if you know, there's only 5 clinics in the UK that have this. So, you know, and we were the first. So I do like to rub it in a little bit, you know, look, well, we were the first to have it. So, you know, we're quite
So
special.
respect. So
We're,
respect.
yes, we're special. You're at a special place, but the patients do feel special. You know, you sort of,
Yeah,
you joke, they say, but, you know, this is, we have this because, you know, we believe you are special and we want to make sure that we collect the best data that we can.
exactly.
And that's it. You know, that literally, that is the decision. The decision is, I want the best data for my patient to give me the best chance of success.
And that's actually turned into a philosophy.
Yes,
I would say a work philosophy on your side.
absolutely. It is. I mean, it's in our philosophy is intention, effort, outcome. And the thing is, if you don't, you know, if you don't have the right intention and you don't put the effort in, how can you expect the outcome to be good? And,
Precisely.
and the thing is, if your intention is the best, so you're going to do the best you can, you're going to put the best effort in. Sometimes you still don't get the best outcome, but you can't be upset because you've done everything you can.
Because you've tried.
You've
You've
tried.
tried with your best knowledge and your best efforts.
And you've
So
also invested. You know, you can't
exactly.
have, you can't do these things. You know, the MODJAW device is priceless for me. You know, it's for me, the money was irrelevant because it was what it was. And I'd pay, you know, if I need, even if there was a new machine out in another year, I'd buy it. It's like, this is now my thing that I have to have in my clinic. It's something that I can't live without. It is like,
Literally, yeah.
it
Totally
is,
agree with you.
it is.
Totally agree. And did you feel like it did enhance your communication with your lab technicians, for example?
Well, what the thing is, it's done something even better because initially the work I was sending out was I was sending it to France. So it was going to the MODJAW lab, and so the communication was excellent. But I really wanted someone in house because we have a ceramist in the practice,
Okay.
so he does all my work. And so now we're actually walking the journey together from the lab side, and
Perfect.
this is like the
I
dream.
believe, yeah, the dream of not only a clinician but also the technician is
Yeah,
dreaming is living that dream.
I know.
I know he is.
Well, we did the course recently, and it was, so we're now just working through the cases together because we've got the cases, and I want him to do everything. But it's not easy learning a new discipline because he's not as digitally trained as he was,
The
analog.
mindset is not still full digital.
Yes, and that's going to take, I'm sure, as you know with yourself, it takes years of
Yeah.
practice and learning and making mistakes and
No, so I just asked, why didn't you scan the preparations and put it in the module as additional models, just to see if you had the correct space prepared for this kind of motion, for this kind of rehab that you're trying to do? And it's about the mindset. It's about the digital mindset. I believe that there's something in this word that's it looks like out of the box, but actually is the digital mindset. I believe it's absolutely the digital mindset that it's not still there, and it needs to be trained as well.
Definitely. I mean, you're trying to understand a totally new technology, a totally new language,
Yeah.
and you have to, put yourself in that zone of. I mean, I've been very lucky. I've only been digital 2 years now, just over 2 years now. So I bought the Prime Scan. So I'm Sirona, Dentsply Sirona. So I love their Prime Scan. I had the Omnicam, then the Prime Scan. And the Prime Scan is, it's stunning.
Out of the box.
It is. That's a brilliant device. But I say, I mean, but they can, their algorithms for their occlusion is not great. So you do need to do some corrections in the software, and it's knowing all this. This is all these mistakes that
Yeah, you learn, and you start living with those let's say shortcuts
yeah.
to deliver and to have the good digital data, the good digital data to work with. This
I
is
mean,
exactly.
absolutely. And the workflow now for me is like smooth. We have a workflow that, detailed analysis. I have the data, and then because prepping and now scanning is so quick. It doesn't. You don't need the length of time that you had before. And you can, so the workflow is very straightforward. Motion data, wax up. Wax up's done. Transfer the wax up. I test that, and then I prep through the wax up and do the finals using the same motion data
All the way, and
all the way.
that's the workflow that you are using every
Absolutely,
day.
all digital, and muscle data at the start. I'm doing muscle data in the provisionals, but what I've found is, and same with the MODJAW, is that the patients become very protective because they know that they're in plastic teeth.
Mm-hmm.
And because they know that the teeth are plastic, they don't function the same. So I found over the last sort of 2 years that the cases, when you do the provisional data, it's not realistic data because
Exactly.
the patient is protecting everything. And once you put them into zirconia or you put them into something,
Then everything goes.
so then they start chewing proper. Then they go, okay, I'm okay now. I can not work. So now we don't do the provisional MODJAW now because I was not getting any benefit from the data. It was, but you would never know this
until you try it.
until you try it. And it was on the bridge case that I was doing. So we did a provisional bridge because we had to take some teeth out and let it heal. And so I had the pre-MODJAW data and then the provisional. And in the provisional, she was so scared to do her motion, and everything was so careful, and she knew that it was plastic, and she was worried that she might break it. And and it just made me, it's, and these are the workflow has changed, but it's changed because, I've got the data from the module. Now I have a good workflow. It's pre-data, wax up, and then I do
and
additive.
straight to the end. Yeah.
Yeah, additive, and then using the same data at the start, we just make some tweaks just to get cuspal inclinations better. But
Yeah.
we make the finals.
In terms of business model, and with all this COVID situation that we live at, but mainly the UK is living as hell, I would say. Let me use this expression also. Allow me that. And has a business model and having the possibility of decrease or at least reduce the number of visits of your patients into the clinic, it definitely needs to have an impact on your business model.
Yeah, I mean, we've sort of modified our business model just according to the guidelines and the restrictions we have, but not, the module hasn't. The module workflow and the system that it's created is so slick anyway that you could do things that you couldn't do before. The motion data alone means that my adjustment time is less. I'm not getting the patient's not coming back with too many complications because the
Exactly.
precision and the fit. I mean, my occlusal adjustment.
Those knock on the doors complaining about there's something that is not right, but I cannot explain it exactly what it is.
Yeah, absolutely. I mean, but what I love about it is that the teeth shape and it gives me aesthetic teeth, but also it gives me really functional teeth.
Yeah.
I've got loads of photographs. I'm happy to share them on the video if you wanted me to.
Yeah, I would love to share and to ask you about if you have some before and after case with you. If not, you can send me later. There's no problem on that. But
Oh
we would
yeah,
like.
I have a load of before and after cases, and
Sure.
I'll just show you one case that this case is a complete digital case because it's both with muscle data and MODJAW and everything, and then you see that sort of the design afterwards, and it's just it's just a lovely. He's a lovely guy anyway, but this is sort of the case here. Now his occlusion is quite a tricky one, and this is sort of
No way. Do you consider that tricky?
well, and his complaint is that his main complaint. I mean, this is sort of the MODJAW
Yeah.
analysis. I love it. We did some muscle data, and his muscle data was not good. So his impact data at the bottom was 20% less than what he could be, and he was really only touching his front teeth.
So there was some loss on the muscular area on one of the sides.
There was disharmony. So
Okay.
basically, it wasn't harmonious. You can see here that he was asymmetrical. Anyway, this is sort of, you can see here the T-scan data was he was really hitting the front teeth heavy, but not really touching the back teeth.
Exactly.
So this is sort of the jaw motion data. So this is centric relation, but I mean, I also look at chewing, and I mean, this is just, how could you
Separate. How can you separate things?
yeah, how could we not know? How could we live without this device before? This is like his chewing motion data. Both right and left. So you see here at the start, his left side is reasonable, and his right side he prefers to eat on his left side. So
Riaz,
sort of,
this is the kind of information that, are you not satisfied yet? Oh, let me give you just one more thing.
yeah. Well, that's it. I mean, we sort of then with Smile Cloud do the design, all the sort of the shape and aesthetic. This is just a video on functional design, so just showing the wax up. So this was a design done by Vivian from Brockus. So he did he's a really good guy. So transfer of the wax up. So you see here, this is just the additive workflow. So just additive workflow, and then sort of looking at the occlusion there. But I mean, look at the shape of the teeth. It's just stunning you know,
Stunning.
teeth.
Stunning.
Absolutely, you know, it transformed his smile. So he's gone from that to that. You know, we've given him a positive over
And
there.
and how's the balance, the equilibrium
Well,
of
there
a
you
patient
go.
like this?
Well, if you see here, you know, his health now is balanced. He's still in the red on a couple, but they've increased and got closer to normal. But the bottom one, the impact is at 90%. His muscle health now is at 90. He was at 65% at the start, you know,
Wow.
and the balancing now of the muscles is much better. His asymmetry is back to normal. But look at this, the asymmetry of the forces. You know,
Yeah.
he's got 50% force each side, you
No,
know. So now,
that's perfect. I would say perfect.
and look
Perfectly
at his chewing.
balanced.
Well, look at his chewing. His chewing now is sort of improved on the right side. His motion's improved, you know, so he's now chewing better.
Wow.
This is his left side, you know, so he's gone from sort of both a very narrow movement to a much wider movement,
Exactly.
you know. So, you know,
Wow.
that's sort of,
Congrats. No,
no, I mean,
perfect. This is
this is
exactly.
thanks to MODJAW, but this is, you know, it's congrats to me, but it's, you know, I could never have done any
You
of
know,
that without.
it's a teamwork based,
Absolutely.
of course, in this amazing technology that we've been talking in this last hour. But you know, the amazing thing is to know how to use it, to get the best advantage on having this kind of device. And I would say, you know, at at the end of the day, what we all want is to have patients smiling and, you know, amazed with the treatment they got from Riaz Yar or from some other colleague. With this kind of technology, they are able to provide. And and I'm not afraid of saying this, you know, out loud, because you know, without this kind of device, you wouldn't be able to study, you know, the right dynamics on the occlusion, on the movements, and on particular, you know, small movements like chewing. They are small movements, but with an amazing importance on the balance, on the equilibrium of the person. So Riaz, again, was a pleasure. What a pleasure to have you here. What a
My
pleasure to
pleasure.
meet you
Thank
and
you.
to have this
Thank
conversation
you.
with you. I
No, my
wish you
pleasure.
a pleasant night and wonderful rest of the week. Okay?
You too. Take care, buddy.
Thank you. Thank you very much.
Take care. Bye-bye.